When you're assessing clients during the overhead squat and you notice that the shoulders start to come up, we have that elevation of the shoulders, this is actually related to downward rotation and anterior tipping of the scapula. Now I know you might be a little confused going, what do you mean? I'm watching the shoulders go up, how can that be a downward rotation? Well, if we look at the little picture here of the right shoulder blade, what we're actually looking for is this portion of the shoulder blade, that outside portion of the shoulder blade relative to the glenoid fascia. As this part of your shoulder blade starts to go up, this will actually rotate downwards. So as this moves up, that will move down. So in essence, when you do see someone's shoulder elevated in that position, it's actually the scapula going to downward rotation. Now, what muscles are responsible for doing this? Well, for downward rotation, we're going to be having pec minor, levator scapulae, and rhomboids. Now, in terms of anterior tipping, this is where that scapula starts to move forward on the actual rib cage. The muscles responsible for that would be the pec minor, levator scapulae, and the upper trap. So come over here for 1 second, Sarah. So face that way for us. And what we're gonna be looking for here is people, and we're gonna exaggerate this a little bit, is as they go into their squat, go ahead, this starts to come up. Now as this goes up, come back up for a second. Now if I place my hand on her scapula right now, go ahead, come down and lift those shoulders up, I can actually feel this start to go into downward rotation. So that's what we're looking for here. Thanks, Sarah. Now in terms of our 5-step system, we've isolated the joint mechanics of what's supposed to happen. Those shoulders should stay down and back. They're not. They're moving up, downward rotation. What's the cause of that? We have some tightness issues that we have to release. On our left side will be the release side, and the side that we have to incorporate the mobility and also our flexibility. Once we increase our mobility, flexibility, release that tissue, it's also important to go to our other side now into our activation. Upper traps, lower traps. You see very few people actually activating the upper traps properly or the lower traps. Also the serratus, those finger-like muscles coming across onto the rib cage attaching into the scapula also need to be activated properly. For posterior tipping to combat that anterior tipping, we're looking at that serratus again and also those lower traps.